Welcome back to Fox 11. Heart health, always a very important component of our overall body health. But during a pandemic, we're seeing even more how important taking care of your ticker is to stay in good shape. And Dr. Ernst von Schwartz, he's a cardiologist by trade. He's also been our COVID expert throughout this pandemic. He joins us this morning with the very latest. First off, Dr. von Schwartz, good morning. Let's start with what we're seeing in the pandemic right now. We hit the 30 million case mark yesterday in the U.S. What are you seeing?
Well, thank you. Good morning, Joe. First of all, the numbers go down. As of yesterday, California had 2,700 new cases, which is less than a couple of days before. So in contrast to Europe, we are in a good shape right now, probably because of the vaccination. What we are seeing now is two things. One is we still see the long haulers, meaning the post-acute COVID syndrome patients, which present months after they had COVID with things like fatigue, insomnia, and especially shortness of breath. And there are some data that if those patients get vaccinated, their symptoms even improve. And the other thing we are seeing is now the pandemic depression, fatigue, and weight gain. And that's why I think we want to talk a little bit about the exercises we all can do at home.
Yeah, now as a cardiologist, I mean, you must be seeing people coming in who just probably over the last year have not been getting the same activity level that they have been. What are some good things we all should be doing when it comes to working out and keeping our heart healthy?
I mean, keep in mind, doing something is better than nothing. So if you don't walk, you should start walking. However, for the heart, the main thing to keep our heart and blood vessels healthy is to keep the blood vessels elastic. So we want to avoid stiffening of our arteries, because if that happens, then that leads to what we call endothelial dysfunction, and that leads to calcification, and that leads down the road to strokes and heart attacks. So whatever we can do to keep the blood vessels elastic is what we call high intensity interval training type of exercise. That means, in practical terms, you really don't need a gym, you don't need much equipment for that, but you need to do something where your heart rate goes up and you have to get short of breath for a brief period of time. So let's say you walk, or you go on a treadmill, or you do some physical exercises at home. You have to do three things. You have to basically stretch, you have to move, and you have to hold. And if you do that at a high intensity level, just for a few seconds, like 10, 15 seconds, 30 seconds even better, as long as your heart rate goes up and you get a little short of breath, this kind of exercise trains your heart, increases your metabolism, helps you to lose weight, and, as I said, keeps your blood vessels elastic.
And we're watching some videos of these workouts that are something that, depending on your age group, and that's an important factor as well, the harder you go depending on your age, right?
Absolutely, absolutely. But again, if you do like a slow kind of exercise pace for a prolonged period of time, that's a good social activity, but that really does not do much for your heart. You have to get a little short of breath. We see a lot of patients when we do stress tests, for example, and they tell us, well, we walk every day a mile or 2 miles, but after 30 seconds, their heart rate goes up to 120 beats per minute. That means they are still deconditioned. In order to overcome being deconditioned, you have to push it for a brief period of time. So with the high intensity interval training, you want to get your heart rate up to 85% of your maximal heart rate, which is defined as 220 minus H, so 85% of that. In order to do so, you have to push it. You have to sprint, you have to stretch, you have to do certain movements, and the more muscle groups you can activate, as in the videos you are going to show, as our instructors Terry and Ashley are showing you, very simple to do at home. The only thing you need is a chair, basically. Yeah. So the more muscle groups you activate, the better for the heart.
Dr. Ernst von Schwartz, thanks so much. We appreciate you joining us every week, giving us an update on the pandemic, and of course talking with heart health this morning as well. Thanks so much.
Thank you so much, Joey.